It's my pleasure today to serve or to moderate this panel of eminent ladies, and I will introduce them one after the other. The first panelist is Professor Janet Turan. She's a professor in the Department of Health Policy and Organization at the School of Public Health, the University of Alabama at Birmingham. She holds a secondary appointment in infectious diseases and epidemiology. Dr. Turan is a social and behavioral scientist with a main research interests in the areas of sexual and reproductive health and HIV prevention and treatment in low resource settings of both developing and developed countries. She is going to make a brief presentation after these introductions. So welcome, Professor Turan. The next panelist is Dr. Edith Kwoba. Dr. Edith Kwoba, with all the introduction I'm going to make, is also my friend and colleague. We've worked together for many years in Eldoret and on the African continent doing research around the mental health of communities, as well as the physical health of people living with mental health. She's the current head of mental health department at the Moi Teaching and Referral Hospital in Eldoret, which is in Western Kenya. Her career goal is to give the best care to patients and to contribute to science through research aimed at increasing accessibility of quality and affordable mental health care at the primary healthcare level in Kenya. She holds a PhD from the University of Cape Town. The next panelist that I would like to introduce is Bini Brambat Sharma. Bini has set up an innovative program, Empower Teens program, which advocates for mental health resilience for teens. And under the umbrella of mental health resilience, the program creates an enormous impact in the lives of teenagers by empowering them early with indispensable skill sets like time management, goal setting, journal practice, changing mindsets, power of the vision board, yoga, guided meditation, and social emotional skills, such that they graduate high school with high levels of emotional intelligence, EQ, IQ, and stress resilience. And we're going to hear a lot more about this in the course of this webinar. Now, having done this then, I would like to now invite Professor Turan to give us a global perspective on this topic. And she's going to make a brief presentation, after which then we will also invite the other panelists to make some interventions, and then we will have a panel discussion after that. So Professor Turan.
Thank you very much. It's really a pleasure to be here. So I'm just going to give a very brief global perspective on this issue. I think we've all heard a bit already about mental health, and it's very important to realize that it is really a comprehensive concept, a state of well-being in which every individual really realizes their own potential. So you can cope with the normal stresses of life, you can work productively and fruitfully, and you can make a contribution to your community. So this is it's a global concept, and just remember that mental health is real, and it's something that we need to prioritize. Sometimes we can't see it or really understand, it's not as easy to understand what it is, but it's just as important as physical health. And what it isn't something to judge people about. It's not just one's emotions, or, it's not something that's easy to manage. And it's because it's not something that's just in the mind, as we will discuss. It's not shameful, it's not a joke. So this is something that we really need to pay a lot of attention to. Now, I'll just mention that the World Health Organization gives a big priority to mental health. It's one of the focus areas, and it's really something that globally everyone is very focused on promoting. Now, what I wanted to talk a little bit about today is, health and well-being, and really the role of stress in our both mental and physical health, and to talk just like what causes stress, what does it do to your body, how do we cope with stressful situations, and then a special area in mental health that I work on is stigma. And so I'll mention a bit about that as well. So we all know about stress. It's all we talk about all the time. And, you know, what are things that stress us out? Major catastrophes, big life events, sometimes physical illness, and just daily hassles that we all, you know, have to deal with. And what's, you know, becoming very clear in the literature and in practice is that this stress actually affects the body, not just your mind, but the body as well. And so we know that stress affects the body in different ways. It has some effects on your heart. It can increase your risk of coronary heart disease. There is also evidence that it can affect your immune system. And so when you have a brief stress, it can cause an immune response. But importantly, chronic life stressors, if you're feeling stress over and over, that can suppress your immune response over time. And, we have, there are different ways of coping with stress. And some of them are, can be very helpful and positive, like seeking social support or accepting yourself or positively reframing what you're going through. But some kinds of coping are not so helpful, like denying the problem, getting into alcohol and drugs, mentally disengaging from everything. So people have different ways of dealing and coping with stress, and that is something that we can work on and learn more. So just lastly, I'll just mention that, again, something that I have worked on quite a bit is stress. And stress and stigma. So stigma is, when a person has some kind of an experience or a condition that is, causes them to lose social value in the community. And we know that some physical health conditions are stigmatized in many societies globally, all over the world, including HIV infection. Mental health disorders have a lot of stigma, and I'm sure we're going to talk more about that. Tuberculosis, cancer, obesity, there are many, many. So thinking about that, and we know that stigma, which is really a mental and social process, it actually affects physical health as well. So stigma can affect the quality of life and the physical and mental health of people who are living with stigmatized conditions. Stigma and fears of stigma make people less likely to use the health services that they need. And stigma can lead to discrimination and violence with adverse consequences for health. And so we don't often really think about this, but stigma, you can this framework kind of shows that when you experience stigma, there's some effects on you. You feel shame, blame, guilt, fear, denial, and those actually have direct effects on your health. But it also affects your behaviors, like you might not want to disclose your stigmatized condition. You might delay getting care or avoid services or not take your meds. And these can, in turn, of course, have effects on health, poor mental health. You can, mortality and morbidity. Sometimes there's violence that happens related to stigma, and then infections can be transmitted. So just thinking about this as a way, that mental and physical health are very closely related. And it's really the mental health affects physical health, and then physical health feeds back to the mental health as well. So thank you very much. I will stop there. Thank you.
Thank you very much, Janet, for the presentation that frames the discussion going forward from a very global perspective. And I would like to invite Dr. Edith Koba to give a regional perspective from where we are at in East Africa. Edith.
Thank you. Thank you very much, Prof. So first, I would like to thank the organizers of this meeting for having me around here. I am very excited. I always start by saying that Professor Lukoya Tuoli is one of my mentors and teachers, and I am privileged to have had him and to have also shared the work that I'm going to share briefly is work that I did with him as my mentor and supervisor for my PhD. So in a few minutes, it would be very complex to try and describe everything about mental illness and physical health. But I'll just try to just briefly remind us that especially for us who are mental health specialists, sometimes it's very easy for you to see a patient and quickly check whether they have hallucinations, whether they are feeling depressed. And from the little experience I've had just working in the mental health field, it is very clear that a lot of times our focus is on the mental health symptoms. And one of the things that we quickly forget is that this person is whole. And when a patient presents to you, especially for those who are practicing in mental health, that we are encouraged to remember, one, they are human. And in addition to having depression or anxiety or trauma or whatever it is that we are dealing with, they likely also could have other mental health conditions. And if you look at a lot of literature that has described mental illness and physical health, there's evidence, one, that unfortunately, patients who have mental illness are likely to die earlier. You can see 10 to 20 years earlier. And this is not because they suffer from conditions that other human beings don't suffer from, but it's because while they suffer, unfortunately, most of us are not primed to think of these other physical conditions. So the call today in the next few minutes is to remind us that there's a very strong interaction between the body and the mind, and we must continuously keep checking for all this. And there's evidence that mentally ill patients die about 2 or 3 times fast, or much more than the general population. And the main causes of death, other than suicide, which is relatively common in this population, is actually physical disorders. And disorders like hypertension, diabetes, lipid issues, and all other conditions are very common. And if you see something like hypertension, sometimes it's not very complex to make this diagnosis. I know, especially as healthcare providers in mental health field, sometimes we forget to even just take the blood pressure of a patient. And most of us will even have forgotten our stethoscope. But the call today is to keep reminding us that we must not, in addition to doing a mental state assessment, we must be able to do this. And maybe just to share very briefly a study that we did, again, that was supervised by Professor Lukoya Tuoli. And for those who might not be familiar with this, it was actually part of a big study, the NeuroGap study that many of you may have interacted with. That's a genetic study that's being done in East Africa and other parts of the world, South Africa also. And I just took a smaller sample as part of my PhD work and interrogated 300 patients and compared this with 300 patients who have patients and other members of the population who have no mental illness. And the question was, do we think that people who have mental illness actually have metabolic disorders much more than the general population? How about the lifestyle risk factors like alcohol, smoking, exercise, and diet? How are we doing on that front? And this work has been published. So in the next few minutes, it wouldn't make a lot of sense to try going into the details and do a lot of presentation in a short time, but you can get this work online. It's actually an easily accessible paper, the whole of the paper, and it was published in +1 in 2021. But simply put, one, we found that true, these patients that we are dealing with who have schizophrenia, who have bipolar mood disorders and other psychotic disorders, actually at twice as high risk of developing metabolic syndrome, for example, compared to the people who don't have mental illness. And yet we found that most of these people are actually not on management. If you look at simple things like obesity, and we know that like our drugs, for example, increase the risk of developing weight gain and other metabolic issues, again, twice the rate was twice compared to the people who didn't have mental illness. And just looking simply at this study that we did in Eldoret, at the rate at which people were smoking or taking alcohol, one of the surprising things that we found is that people are not reporting as much whether they are taking alcohol or not, but it's both the patient and the general population. But clearly, at least there was much more smoking. And if you look at the even simple things like taking fruits and vegetables, you can see 97% of the patients that we interacted with actually were not taking what we would call healthy diet. If you look at the physical activities, again, things that would improve their physical well-being. Also, 78% of the patients were not doing enough exercise. And you can see also there's a lot of sedentary behavior, things that are likely to have a negative effect on both their physical wellness and their mental wellness, because we know, as a matter of fact, that things like exercise, in addition to benefiting their physical health, also tends to improve things like depression. And if you look at therapy like behavior activation that we advocate in depression, we tell them do something active, get active. And the problem is they are not doing as much, and a lot of times we are very quick to do a mental state assessment and prescribe medication. But the question I have for all of us is, how often are we asking patients, how is your diet? How much are you exercising? Smoking, if you think it's a problem, should we be stopping it, or is it sometimes seen as none of our business? So I think in summary, what we are saying, it is there's evidence, and we could spend the whole day trying to bring their attention to all of us that the fact that physical disorders after suicide are causing many people with mental health issues to die. And the problem is that a lot of times we are working in silos, and we are separating physical disorders from mental disorders, yet the relationship is very strong, and we're encouraging ourselves to have a holistic approach to the patients that we're interacting with, so that we are not just interested in one. If we are physicians, we are not just interested in the physical health, we're also checking the mental health issues. And if we are psychiatrists or people working in the mental health field, we are also interested in their physical wellness. And the truth is, there are simple interventions. For example, we've seen smoking is a problem, lack of exercise is a problem, and we don't need very, very complex interventions for us to be able to improve both the physical and the mental wellness of the people that we're interacting with. Asante sana, back to you, Prof.
Thank you, Edith. And yeah, you have thrown a challenge to those that take care of people living with mental illness to think about their physical health and the risk factors that many are exposed to. And when people go for wellness checks, all these things are checked, but when somebody comes for a mental health check, then we don't think too much about their physical well-being, as well as the risk factors for chronic diseases like cardiovascular disease. So good job with that. And I would like to invite Bini to give a perspective that is unique, and perhaps is even more unique because of the context of AKU, the Aga Khan University. The Aga Khan University has a huge footprint in East Africa, but also a huge footprint in Karachi and other parts of Asia. And Bini is in a space where she can give us a perspective that looks at Kenyan community, especially of Asian origin, and thinking about how do they look at this issue of the connection between the mind and the body, and how they interact with each other. Bini.
Thank you very much, guys. Thank you so very much. I'm humbled to be here amongst all the other fellow panelists. I'm going to start with the quote that Dr. Merali said, "No health without mental health." And yet the words stigma and mental health are more attached to each other than anything else. As an Asian and Kenyan community, if you observe, we are culturally quite conservative. And in my observation, while working in this for quite a number of years now, what I have witnessed is that two extreme realities coexist. So there is one reality where people are comfortable saying, let's suppress our emotions in the name of showing strength. And yet the world of medical practitioners are talking about addressing our emotions and deep diving into them and walking through them. And so that's where healing happens. So there is this one reality, and the stark reality that is also presented is the amount of anxiety disorders and panic attacks and the suicide cases amongst adolescents are at an all-time high. So both these realities are coexisting. Yet what has been observed is that when the real deal happens, when people are suffering with anything to do with mental health, there is a pause. And that pause can be as long as one needs to take. I'll give you an example. I was doing the speaking engagement with a group full of CEOs. And I started by saying, raise your hand if you've been stressed this week. And there was not a single person who raised their hand. And I made a joke like, I'm not asking about your mistress, I'm asking about your stress levels. And everyone laughed. And then I started with raising my hand that, yes, I've had a stressful week. And that's how slowly people started raising their hand. Now, that's the reality. My job as an adolescent mental health consultant and a teen mentor is to make conversations so normal around mental health. And one of my pet story is always that think about the times when we were young. All right, we used to not go to a dentist. No, it was just a normal thing. Our parents used to never go for a monthly checkup, for their tooth or anything. And yet today, as parent, I know how often do I take my child. I do ensure myself that I go to a dentist regularly, because we are learning that what our parents went through with their mental health shouldn't be repeated with us or our children. And that's exactly how the mental health is going to be. Very soon, every family is going to be having a therapist. I have always been a proud, I confess to people that one of my birthday gifts to my 18-year-old daughter was a therapy session, not because she needs help. I think everyone needs help. And I believe therapy is growth. Therapy is about finding yourself. Therapy is about discovering who you are and why your behaviors are the way they are. So in a nutshell, what I've seen in my observation is there is a huge gap between the world of practitioners, mental health practitioners and psychiatrists and therapy, and common people who do not even want to put a word to it saying, okay, I need help. And that is a lot of work that we all can do together, talk about it, do campaigns. So thank you once again. I conclude with that, and thanks a lot for listening.
Thank you very much. And I think the perspective you bring to the discussion is not necessarily restricted to the Asian community in Kenya or in Asia. I think many of us, if you go down to the communities, attitudes are pretty similar. And you'll find many conservative people who are not willing to speak about mental health. They have no idiom for it. They have no words for the distress that they encounter. And on the other end, you have people who are pretty open about discussing this. I want to go into a panel discussion. And because of what you said, there is an assumption, and I'm going to flip things around a bit. There's an assumption that those that are reluctant to speak about mental health are our young people. We hear, people sitting in mental health planning spaces arguing that you have to find, you have to create the right environment for young people to talk about their mental health and so on and so forth. So this is a huge assumption. And I want to come back to you, Bini, because you work with young people, you work with teens. And so you might just take a moment to answer this question about whether it is indeed true that it is more difficult for young people to speak about their mental health than older people. But as you do that, then we would like to see what strategies you would recommend for young people to improve both their physical and mental health, and the role for sports and physical activities in maintaining good mental health? So just dive in and
Straight.
guide us in that.
Thank you so much again for asking that question. On the contrary, what I've witnessed in my work working with teens and youth is that they are far more open. They are ready to talk about it. I had this amazing moment when I was in a group session with about less than 20 numbers of teenagers, and I said, raise your hand if any of you have even once dealt with a panic attack or an anxiety attack in the last 6 months. And surprisingly, every hand went up. And they're not ashamed talking about it. They understand where this comes from. They are ready to talk about it. They have their own groups to talk about it. However, what I've seen is it's the community which is not ready. It's the structure that we are in which is not ready. It's the parents who are not ready. And that goes back to again understanding that if you look at our ancestors and you look back at how we were raised, it was all about physical strength. And food, shelter, and clothing was our fundamental need. And that time, understanding the attachment needs or understanding the need of connectedness was a given because it was just there. It's as we've evolved and come into a world where we are really screened up and there is an urgency culture and people are just on their phones is where we've realized that connection is diminishing. And in that space, we are not ready to step back and say that, oh, okay, that is one of our most fundamental needs. You actually look at the structure of our brain. Okay, the structure of our brain itself says that any event that we experience, any experience that we have in each moment starts from feeling something. It's that later that the emotional part of our brain starts sending the message to the different parts of our brain, and finally it goes to the prefrontal cortex. And then we know, oh, okay, maybe I shouldn't talk about it. But the fact remains, as human beings, we feel something first. And yet, every time we say that, okay, I'm feeling this way, how often are we ready to suppress that? And it's less to do with an intention. It's more to do with the lack of awareness. So I'll come back to the same thing, that it's the environment, the community, the schools, the teachers, the adults in the life of teenagers that need to wake up to the necessity of this mental health situation. Because one of the things that I take it to my heart and which evidence says is that there is highest amount of suicide cases, depression cases, anxiety cases, self-harming cases in our teenagers. And the faster we talk about it, the more we do about it, that's the only way to work towards diminishing that. I'm going to quickly get into the strategies that I usually share with the teenagers that I work with as a group or even on my speaking engagements. Number one, the word ritual gives you a warm feeling in your heart, most often than not. Any ritual, whether it's family ritual, whether it's ceremonies, whether it's religious rituals. And so I always remind children, adolescents, youth, or even adults sometimes, that get into a practice of rituals for yourself. So show up for yourself. That means healthy rituals like your morning ritual can start with not seeing your phone for good enough reasons, I think everyone knows, but not looking at your screen. Number two, just to wake up and stretch. As soon as you finish stretching, you make your bed. Stretching and making your bed sends a signal to your brain that one activity is done. It's exercise, it's endorphins release, it's happy hormones. So a simple routine like that, starting your day with a banana, with a fruit, any fruit directly takes care of your mood regulator, your serotonin, again, a happy hormone. Another routine could be, another ritual could be the evening ritual. One thing I always have reminded children and adults together is the simple form of journaling. Okay, there is no way one can know their mental health if they don't know themselves. Okay, journaling helps you clock your patterns. Journaling helps you understand where you are on an everyday basis. A pattern comes up and you're able to say, oh, okay, for a week I've been feeling low. So before bedtime, have a practice of just journaling how your day was. Maybe a joy journal, maybe a journal of knowing which friends made you feel toxic or which friends made you feel excited about life. That kind of conversation with yourself brings in awareness. With awareness comes clarity. So a ritual which is based on your morning routine, on your evening routines is number one. It's a very important part of controlling things which benefit your mental health. Number two is the importance of connectedness. Okay, I said this earlier, I'm saying it again, that we are social beings. It's our fundamental need to find acceptance in the society, being loved, being connected. And so that means that when they are at school, it's their job also to find friendships that nurture them. Okay, be aware about the friendships that are toxic. Be aware about friendships like, which make you feel good about yourself. And then try to do things in that capacity in between your lessons. So you feel some level of connectedness with your fellow mates and even at home. So rituals, connectedness. The third is the most underrated one, but I'll say it nevertheless, is playtime. All right. Children need a lot of enthusiasm and creativity. And yet the structures, the academic structure that we have today is kind of not giving a lot of enthusiasm and creativity. It's a structure that is a certain set rule of a structure. But what they need for their brains to develop is a lot of enthusiasm and creativity. And I remind children, adolescents, that you can do that, even if it's playing rock, paper, scissors, even if it's playing 10 minutes of football, even if it's just paper flying, jet flying things, or doing something fun that in that moment makes you wonder about your surrounding. So playtime is extremely important for a healthy brain development and for your mental health. Last but not the least, and it's very important, is just bringing in the awareness to their gut health. Okay, we talk a lot about brain and the neuroscience behind mental health, but your gut health plays a huge role. We have about 200 million cells in our gut, and there is a reason why it's known as your second brain. But in my opinion, your intuitions come from your gut health. Your gut health is a direct way of knowing if you're not being able to sleep well, there is something wrong with your gut health. And to maintain a healthy gut health, one thing which is very important is nourish it. As teenagers, your hormones are going up and down, they are fluctuating. Your prefrontal cortex is not yet completely developed. You are impulsive, you're emotional. And so it's so much more easier for them to forget about feeding their physical health and nourishing their physical health. And so I remind them that a simple ritual of eating protein and carbs and drinking enough water and natural sugar and fruits, just these 4 simple things at regular interval. If they can go to bed saying that as long as I got enough proteins and enough carbs and a good amount of water and a good amount of natural sugar, yeah, you're taking care of your gut health. And because that also takes a difference in the way your brain works, or how you think. So in a nutshell, these are the strategies that I remind them of.
Brilliant. Perfect. Thank you. Thank you very much. I think plenty of food for thought, literally. I mean, taking care of your gut and what is happening in your gut. And yeah, another aspect of which, as you nourish it, of course, you're aware that it's called a second brain or a brain because, in fact, it has a lot of nerves that respond to what you eat, that respond to your environment, and so on. And there are a lot of other things that live in there that also regulate how we feel and behave. And I want to go to Professor Turan, who has worked with pregnant women living with or affected by HIV and stigma in this country. And just basically looking at the physical health of pregnant women and how this affects their mental health, probably through the course of the pregnancy. And what sort of things do the people living with pregnant women, what sort of things should they be aware of and think about?
Thank you. That's good questions. And yes, I have been working on health of pregnant and childbearing and postpartum women in Kenya for almost 20 years now. And we've done a lot of great work, mainly in the Nyanza region. But I just want to say, pregnancy and especially after the birth are particularly vulnerable periods for mental health globally in every culture. And, we know that some women suffer from stress, anxiety, and depression during pregnancy and after the birth. And particularly if women are HIV infected, they have some special challenges. So their physical health condition, which is, they have HIV infection, and also the discrimination, stigma, and potentially violence that they face may result in internalizing that stigma and feeling bad about themselves and their own self-worth, and then depression and other mental health challenges. So, and then if women do experience internalized stigma and depression during pregnancy, then they're more likely to stop taking their medications, to drop out of care, and then that leads to negative effects on their own physical health, and of course the risk that they may transmit HIV to the baby. So it's again the cycle of mental and physical health. I mean, maybe, and it's also been, women who have mental health challenges are often more likely to get HIV because they don't protect themselves or get into risky sexual behavior. And then, after getting HIV, then that causes other, mental health challenges that then feed back into the physical health. So it's really so interconnected and a cycle. And what I would just say that, for people who are supporting or living with pregnant and postpartum women, and especially those who are living with HIV, but realize that they may need extra support. And they could really, and often, again, people it's stigmatized, they don't want to talk about it, but just realize that male partners, family members, everybody need to ask and give extra support to these women, and also recognize that they may need the support of a counselor or a psychologist or somebody to help them. And some cases it can be as severe as what we call postpartum depression, which is a very serious and real thing. So I think that's just paying attention, giving support, listening, and making sure people actually get help from a counselor or psychologist if they need it. Thank you.
Brilliant. Thank you. Thank you very much. And I will briefly move back to Edith. While she's already addressed a lot of this in her earlier presentation, I would like you, Edith, to then just identify some of the few things that can be done or that need to be done in order to improve the physical health of people living with mental illness.
Well, I think the first thing is awareness that these patients they are whole human beings with issues, because I think sometimes we are so focused, as I had mentioned. And one, ensure that in addition to asking all these questions that we ask, whether you are sleeping well, whether you're hearing voices, we actually check simple things like exercise, like diet, like just their usual patterns in life that indicate that their lifestyles that they are living that could increase their risk of mental illness or even worsen the mental illness they suffer from. But the other important thing is ensuring that even if you are a mental health care provider in your setting, are you even taking a simple weight, and are you interested in it? Because it's one, there are some hospitals where you find the nurse could take the weight of the patient or the blood pressure, but you as a provider, do you actually check and find out whether it is normal or not, or is it just a routine? So we need to make sure that as much as we are writing the drugs very quickly, which we are, especially for psychiatrists, we are made to believe that's what we should be doing, we're also checking the physical aspects. The other thing is ensuring that we are working with other team members. We are not, sometimes, especially when you specialize, it's understandable that you may not remember everything about all the nutritional advice. Are you working with a nutritionist, for example? Are you referring to an occupational therapist where you think maybe someone can be assisted to get into activities that can improve their activities, their activities of daily living, for example? Are you working with a physician if you suspect that the patient could have a medical condition that may need attention and you're not the expert? So remembering that although we are in silos in terms of our training, we have different experts in different areas, and we should be able to consult when necessary. So that's what I think is important, that we are interested in the physical wellness of our patient, and we are actively looking for any evidence of physical and wellness, and we are recognizing that we are not the experts in everything, and we are referring appropriately. But also more importantly is that we are also doing the same for ourselves, because maybe we forget because we also not doing it for ourselves. Thank you. Back to you, Prof.
Thank you, Edith, for that very clear presentation on what we can do and what we must do indeed to improve the physical health of people living with mental illness. Now, we are going into the question and answer session. And so the first question that we have is about culture. Is culture a part that, or one of the things that disturb mental health, or does it control us and save us from anxiety and depression? And this person believes that we are a lost generation. Where we exist, we don't know. And I would like Janet Turan to try and disentangle this for us, if possible.
That's a good question, and oops, can you hear me? Yes. Yeah. Okay, a good question, and somewhat challenging, because I think it, as the person posing the question, it can really work both ways, right? You know, some parts of culture can feel very restricting and, you know, maybe stop us from speaking and asking and acknowledging and are sharing our feelings. But other parts of culture can be very supportive and help us feel part of a community and the connectedness that Benny talked about. So I think it's not straightforward there, and I think maybe we need to embrace the positive parts of our culture, and maybe, you know, resist some things that are keeping us from communicating about these important issues. So that's my thought.
So that sounds like a call to evolve the cultures that we have. And obviously, naturally, the cultures are evolving as they interact with each other, as people move from where they were born to other places. Their outlooks and behaviors and traits are changing as we watch. And I think, so we are saying that we can adopt the things that are helpful for our mental health as we talk about culture, but try and leave behind those that are unhelpful to our mental health. And the culture is not static, it is dynamic. And so even the person who feels like we're a lost generation, this awareness of being lost is the first step in getting found. So it's not necessarily a bad thing or a negative thing, but this awareness is important to begin and say, there's something that is not right, and we can start working to correct it. I'm looking at the next question. The way people with lived experiences frame their illnesses is important in management. How can clinicians engage the patients in care and management of their mental health? And this, I'm throwing it at the clinician in the room. Edith, could you tell us how do you help them frame their illness, and how do you use this and help them help with their own mental health?
The first most important thing is to acknowledge that the patient is the one who has issues. Sometimes we are very academic and we think we know what the patient needs. And so reminding ourselves that while we have been taught and we have very complex knowledge in our head, the patient has their own experience of illness. So listening to their expression of their own experience of illness and addressing it. Of course, sometimes the patient's ideas could be very complex, but help making sure that first the patient knows that you understand, or you understand what they're talking about. You're willing to support them as they wish to be helped, even if you're limited, and you can refer if need be. But most importantly, helping the patient understand what they are going through, because especially in our setting, we find people who could come and say, I am bewitched, or I'm stressed, and I'm not mentally unwell, I'm just stressed. And understanding that that's how they understand it first, but it's also your business to educate them that whatever they could be calling stress is actually depression. And then making sure that you have explained to them the treatment options, and making sure that you're not just prescribing, especially for those of us who prescribe, but you're letting the patient know that, for example, mental health treatment is not just medication, there's a biopsychosocial approach. So I propose that we could use medication. I also propose I could send you to a psychologist. I also think that you need to do something about an X aspect of your life that's a stressor. What do you think about it? You see, unfortunately, previously, we are taught that we are the ones who know the illness and we are the one who know what is best for the patient. Then we complain that there's non-compliance. So just making sure that first you have understood the patient as they present it, explaining to them whatever they could be going through, telling them the option, and making sure that the option you choose is in agreement with them and reminding them, especially for things like medication, sometimes it gives you side effects or sometimes it's uncomfortable. I'm here to support you because you need it, and I'm willing to make sure that we can change if need be. Or even if you send them for therapy, letting them know that sometimes you go to a therapist and maybe rapport is not established or you don't feel fully supported. But in case that happens, you can come back and we can discuss. So it's a continuous discussion, and the patient is part of care. If we are going to have some compliance of some I don't want to say compliance because compliance is us dictating. If you are going to have some cooperation so that they take the medication and the therapy is helpful.
Mm-hmm. Thank you very much. So this obviously speaks to the fact that so obviously a person who is experiencing distress or a person who has an illness knows more about that illness in their own context than anybody else can. And so it is important for us to get to understand their perspective, where they're coming from with that illness, and to look at the resources in the environment that they can mobilize to get better. And I think we have recently written a commentary in World Psychiatry that looked at how Africans experience mental ill health and how traditionally we have been describing it and dealing with it, and how this diversity of perspectives enriches the world of psychiatry, and how it enriches how we diagnose mental illness, and therefore how it must enrich how we manage and treat mental illness. The ultimate goal of it is that understanding a person's unique circumstances in the context of the illness you have diagnosed is key in management of that patient. The next question that we would like to address is, do you believe that schools need mental health advisors? Because this mental health illness is not really a genetically passed disease. It is mainly due to our surroundings. I would probably point out that, yes, there is a genetic component for many mental illnesses, and these genes have not necessarily been found to say this one gene causes this one condition. It's a very complex relationship between our genetic makeup, which is really like the recipe for what we become, and our environment and how we interact with it, and how we think and how our brains are made. All those interact in complex ways to result in mental illness and distress. However, there's a part of that question that I would like Bini to answer, if you put it up again.
Yes, I totally agree that a part of our mental health illnesses do come from our genetics. But a huge part, especially in adolescence, is to do with their environments. And I'll explain to you how. Like I said, times have changed. We are screened up. There is a lot of academic pressure, parental pressure, peer pressure, social media pressure. And so a child is going through a lot in a nutshell, while what is missing is a safe space for them to speak about what they are feeling. Because in those days when we were growing up, our parents were still pretty much, one parent was at home giving us that connectedness and safe space. Whereas in today's times, both of the parents are working. So a child is missing some form of connectedness, a safe space to talk about them. And from a neuroscience perspective, I'll share something which is very simple to understand. If this is your brain and this is your prefrontal cortex, which is completely developed by the age of 25, every time you go through a stress reaction or a stress trigger, your prefrontal cortex goes completely like this. So your entire limbic system is exposed, and that's where the fight and flight happens. Now, if this happens once in a while, once a month, once a week, maybe over an exam or a sports event, it is good because that builds mental health resilience. The problem is that this happens over and over and over again when a child is picked, when a child is bullied, when a teacher is stressing, when there is a lot of pressure. So when this keeps happening, how do we expect a child's brain to develop in a healthy manner, especially when their prefrontal cortex is still at work in progress, at a developmental stage? So how a surrounding treats a child and adolescent is extremely important, and each of them play a role in giving them that safe space. So talking about it and creating an awareness and having mental health advisor is one of the biggest way to go. So I hope I answered that. Thank you.
Brilliant. Thank you. Thank you very much. We have time for one or two more questions, and we're going to put this up. yeah, so this question is from a person with lived experience of depression and anxiety. And she or he is asking, how do they deal with memory loss that's associated with depression and anxiety? May I ask Edith to address this?
Thank you. I think one, memory loss. I feel like the first point would be a proper assessment of how severe the memory impairment is before we can make a judgment of the best way possible. So please visit your nearest healthcare provider to assess that. However, it's always good to know that in the context of depression and anxiety, some people may forget a few things. It's not because they have dementia, it's not because they have an aspect of the brain affected, but it's actually part of the depression, especially people who have severe depression. So would the treatment then need to be optimized so that memory improves? So please visit. Of course, for some patients, we may need to do even interventions because severe memory loss is not very characteristic of depression. So you may need investigations to establish whether there's anything else that's affecting the ability of your brain to remember. So investigation, further assessment, evaluation. Thank you.
Thank you very much. I think, what Edith has said is absolutely important. It's important to note that memory is a function of how we collect information from our environment, process it, and store it, and then try and retrieve it. So if you have severe depression or severe anxiety, then you may not be paying attention to certain things in your environment, and therefore it will be unlikely, you are unlikely to remember those things if somebody tries to get that from you. So it might be because you're not actually paying attention, you're paying attention to internal cues, the distress, or to other things. And so it might not just be that you have a physical problem with your brain's ability to store memories, but it might be because of the attention and concentration and so on. And there are multiple reasons why somebody might have difficulties remembering things. And as Edith says, it's important to get assessed to determine whether it is related to the illness or it is something else that is happening, or even something social that is causing you not to be able to remember things. It's a complex thing. We're going to take a last question. And then obviously we'll note that there are very, very many questions that have been asked in the chat. And we are going to those questions will be curated. The panelists will be given these questions, and the responses will be put in a place that's accessible to all the people who have attended this webinar. Now, this question is about what is the modern day role of traditional Oriental mindfulness practices, such as meditation, breathing exercises, Tai Chi, etc., in addressing mind-body dysfunction. And I'm going to have all the panelists weigh in, take a minute and tell us what they think about these traditional practices and how they affect mental health. Beginning with Janet Turan.
Well, yeah, I'll just say that any kind of practices that slow you down and allow you to pay attention to your body are amazingly effective for improving your mental state. You know, just breathing, even just a few minutes of deep breathing, you'll be amazed. So I would say, you know, those practices are all beneficial if they can do this kind of job.
Okay, Benny, what do you think?
I completely agree with Professor Janet. I believe that one of the biggest role is our thoughts that play in our deteriorating mental health, especially when they are ruminating and we get into a loop. What meditation does is basically does not make us chase our thoughts. It basically helps us pause and ask ourselves, where is that thought coming from, rather than us chasing the thoughts. So it kind of calms the monkey mind. And it could be, I mean, I always say this to my adolescent mentees, that meditation word sounds overwhelming and intimidating, but it could be as little as 10 seconds or even 5 breaths, and that could be the beginning. So I'm a pro when it comes to meditation as a practice for a better mental health. Thank you.
Very good. Edith?
Science has actually shown that there's room for such things as meditation, relaxation training, because mental illness is not like physical disease where you just give a jab or something and they improve. There's more to healing than just that. So yes, and there's if you're interested, you could look up evidence-based studies that have shown that there's actually significant improvement with this practice. So if you believe, of course, there are some people, I remember presenting this in a Christian setting about meditation, and people were like, but we don't prescribe to that. And said, okay, in the context of Christianity, if you don't like it, but still there are principles at work in it. So of course, unless there's any belief that contravenes that, they work.
Brilliant. And so what has happened is that a lot of these practices have been distilled into something like mindfulness, which is not attached to any belief system, but it is a practice that is healthy, that grounds you in the here and now, in much the same way as meditation would, in much the same way as prayerful contemplation would do for those that are Christian or Muslim, and so on and so forth. So distilling those core elements of those practices and then packaging them so that people can do them. And as Bini says, you can do it for 10 seconds, you can do it for a minute, and get into a frame of mind that then allows you to focus on the things that are important and perhaps to stop thinking about things that are not as important. So I think on that note then, I want to end the Q&A session at this time and thank all the panelists. It's been brilliant hearing from you, spending an hour thinking about our minds and our bodies and how they interact in complex ways to make us who we really are, whether in health or in disease. And by way of closing, I would like to invite Professor Zul Merali to make some closing comments and then hand back to our team here for further instructions about the way forward. Zul.
Thank you, Dr. Lukoy. I think that reflecting on the last discussion that we had, I think it's so important. It brings to mind the balance between some of the new practices that come to Africa and come to Asia, come to developing countries from developed nations. So there is a way to approach mental ill health that has been developed in North America and in Europe. But we often, when we adopt those, very often we forget about the practices that were sustaining us and our well-being here in our countries. And so I think the trick is, how do we find those best practices and find a good balance? Because I think it's not all or none. And we very often learned from the old cultures that, for example, the traditional yoga practices and things like that, we're now rediscovering that those are highly effective in the measures of mental ill health that we can follow. So I think this kind of behooves the point that we need to also be very mindful about what are some of our traditions, some of our cultural beliefs, some of our cultural approaches, and how do we find a good balance between the two. So with that, I think that this balance between the brain and mind is so important, mind and body. And so with that, I'll say thank you very much for the panelists for such a insightful view and dialogue about and reflections on how the body and the brain interrelate to each other. It was a brilliant presentation for all of you. So I would like to thank the panelists, particularly Professor Turan, Dr. Edith Kabwa, Bini Sharma, and Dr. Lukoy for really moderating and excellently moderating this session. And of course, to our Dr. Candy Muchungi, who is organizing this whole event, supported by the team. So thank you all. Thank you very much for our participants. I see that the numbers have hardly gone down. They're very engaged, so you really got their attention and they're very focused on this discussion. So thank you for those that participated in learning about what are the current thoughts about the connectedness between the mind or body and mind.